Great, and with that, I'm going to turn it over to Sarah Sugars to introduce our presenter.
Welcome everyone. My name is Sarah Sugars, class of 2020, and it is my absolute pleasure to introduce Professor David Lazer. I had the great fortune to be among David's students while I was getting my PhD at Northeastern, so I know firsthand that he is an outstanding mentor and teacher in addition to being a world-class scholar. David Lazer is University Distinguished Professor in the Department of Political Science and the College of Computer and Information Science. He co-directs the New Lab for Text Maps and Networks, and serves as Director of Graduate Studies for Northeastern's Network Science Institute, a program which is among the first of its kind in the world. It is David's vision and dedication that has made this program, this innovative program possible. He has received numerous awards and honors for his groundbreaking work, which has truly shaped computational approaches to social science. Currently, David is the lead researcher for a multi-university nationwide study aimed at gaining real-time information related to the COVID-19 pandemic in order to support informed policy decisions. It is my honor to introduce Professor David Lazer.
Thank you, Sarah. Thank you for that very generous introduction. One of the true pleasures of the program is to have students like Sarah, who's extraordinary and who is on a terrific postdoc now at NYU from her apartment in Somerville until they actually let people back in New York. And so also a quick shout out to Charles Levine, a current student in the program who's taken a little time off teaching at West Point. So lovely to see you in the crowd, Charles. So I'm gonna before I really, let me just see. Before I begin, I should just acknowledge that this is a huge collaborative project, and I'm not even probably acknowledging quite everyone who I should be acknowledging, but this is a multi-university project. I'm largely going to be providing results from this large survey we've been doing. So there's involves folks at Harvard, Northwestern, Rutgers, and they're terrific. And this is very much a joint effort. And this is also a result of the work of many wonderful collaborators and my students and postdocs at Northeastern, who I'm very fortunate to work with. And also acknowledge the funding support, and especially I'll thank Northeastern actually directly for beginning this project before there was any guarantee of any other support. So, going to review a timeline we're all familiar with. So we had the emergence of COVID-19, of the novel coronavirus, actually before it was named, in late fall, winter in China in 2019. And by February, it became pretty apparent to those in the know that it would spread globally. It was spreading in Italy pretty aggressively in February and other parts of Europe. And by mid-March, really, the US just came to a grinding halt. It was, and really, since then, we've been in an effort to start and go. And a lot of that has been happening locally as we've had flare-ups. Obviously in Massachusetts, I suspect many of you are in Massachusetts, had a pretty awful March and April. But it's been much better since, but we do seem to have our numbers going up again. So we should be wary. What's so special about COVID-19? There are really three things, right? Number one, it's highly contagious. It's deadly. It's not as deadly, say, as SARS, but much more so than the flu. And then the magic ingredient that has really made everything happen is that asymptomatic people spread it. So you can be infected and infectious, but show no symptoms. And this is the key distinction from SARS. SARS is a close relative. It was another coronavirus. It was spread in 2003. And for the countries where it spread, it was quite frightening. But in the end, the key thing was that it was clear you were symptomatic, meant you were contagious, and if you weren't symptomatic, generally it meant you were not contagious, and that allowed isolation of people who were infected. And it was that element of SARS that allowed control of the spread of the disease ultimately. COVID-19, in contrast, many people who are infected never show any symptoms, and some who do show symptoms are spreading, they're infectious before they show symptoms. And that's what makes it so really difficult. And the fact that it's contagious and that it's deadly make it altogether a very scary package. We began, the group that has been working on this began, realized, well, this is going to have societal impact. And we started doing this massive survey in April to understand people's behaviors and their attitudes about COVID-19. And really the objective has been to be able to drill down to the state level. And I would point you to covidstates.org, where you can look at, we've issued 15 reports on this to date, and we'll be issuing another report Friday and probably another 2 reports next week. So there's a lot of stuff, and I'm just going to sort of scratch the surface here. I also apologize for the mixed quality of the graphics because we wanted to show you some stuff we haven't showed anyone else. So we produced some images just this morning, but so they're spanking new, but they're not, we haven't made them pretty. So I'll apologize in advance for that. So I'm going to just give you some sense of what we have found and then open it up for discussion. As I said, here are some of the themes that we have covered in these reports, and some of them we've returned to again and again, like executive approval and vote by mail. So some of the highlights I want to cover today, one is around health and economic impacts on people. Second is what policies do people support. Third is how public health behaviors are evolving, and I'll give you some preview of things to come. So impacts of COVID-19. I think the metaphor I like here is that of an automobile accident, right? So in some sense, we're all in the same vehicle, right? We're all being affected by COVID-19, but you can have an automobile accident like this one where someone walks out of there shaken but unscathed, and another person has been seriously harmed or killed in the accident. And I think if I were to describe the impact of COVID-19 with a word, it would be unequal. That different people have been affected in dramatically different ways. It's really in some sense a function of 3 things: biology, sociology, and luck, right? So on the biological side, the disease affects different people differently because of their biology. Sociologically, how we organize our society affects who is most likely to be harmed, both in terms of getting exposed to the disease, and then also being affected by the economy. And then luck, being in the wrong place at the wrong time. If you look at the picture in the bottom right, it's the Marriott at Long Wharf, and there was a massive conference, or not even that massive a conference, but there was a conference there in February that turned out to be a super sharing event where many dozens of people got infected. And of course, those people were generally, actually, if by any way we might cut it, generally very privileged people, but they got hit first. And not only that, but then that also meant that Boston, Massachusetts ended up being earlier on the curve just because of this one event at the Marriott at the Long Wharf. And so, so there's a lot of luck. Bad luck involved in, and sometimes good luck involved in both at the community level and the individual level. And I'm not a biologist, so I'm not really going to focus a lot on the biology, and luck is luck. But I do want to talk a little bit about the sociology of this. And I'm going to just talk about sort of various categories of people. For example, looking at age and gender. We see mortality risks, and this again, it gets at some of the biological element, that mortality risks are much, much higher for older people. That's generally true of most pandemics, that older people are more vulnerable. It's not true of every pandemic. Like if we looked at the 1918 pandemic, it actually seemed to especially hit younger adults. That was one of the unusual things about it. But here the age gradient is ferocious, right? So like when I had my last in-person class, and I'm not particularly high risk, and I have not a huge class, but with my last in-person class, I'm like, I know we're going to have to shut down. It wasn't official yet, but we're going to have to shut down for a long time. And we added up, based on the numbers at the time, the fatality risk of my students versus me. And my fatality risk was greater than all of my students put together in the classroom. And I'm not that old. It's just that, you know, they were in their 20s and I'm in my 50s. And my risk is much lower than if I were in my 70s. And then also gender matters quite a bit. And this is again, like men are around 2.5 times as likely to die if they're infected. And so that's, some of that is a lot of that is just biological. But then we also see in terms of gender that the economic impacts are likely higher among women, especially women with children, because there's often unequal childcare burdens. And so when you have your childcare collapse, as has happened for many households, the resulting additional household burden, not always, but disproportionately is going to fall on women. And indeed, we could see at the most recent job reports, the change in the workforce, the numbers for men and women were sort of tracking to each other in not good ways, but then in August and September, we see a separation between men and women, and that's almost certainly because of school reopenings, but reopening virtually and so on. And so that almost, that just again reflects that in part has to do with how we organize our society. And that existed before, a lot of those things existed before COVID-19. Or if we look at race, we can see many more COVID cases, coronavirus cases per 10,000 people among Blacks and Latinos as compared to whites. And a lot of that, if we look at things like behavioral things, like in our most recent survey, and this is just reflected for all of our surveys, things like visiting a friend in the last 24 hours, which is potentially outside the household, which is potentially a moderate risk thing, depending on how you do it. Very similar numbers across whites, Hispanics, and Blacks. Adhering to mask wearing, we actually have higher adherence to mask wearing among Hispanics and Blacks than whites, but actually notably high. The numbers have gone up for all groups. But then if we look at mobility, and this is from the New York Times, and this is looking at income, but also which correlates in these urban areas that the New York Times is looking at, we see that mobility for the most affluent dropped faster in March than it did for poorer neighborhoods, again, poor disproportionately Latino and African American neighborhoods, and stayed higher. And a lot of that is because of employment situation and a transit situation. So like if we look at having to take mass transit and this is just again most recent, but this is a robust pattern. We see white respondents, Hispanic respondents are 3 times as likely to say they had to take mass transit in the last 24 hours, and Black respondents around 4 times as likely. And that's that exposes you to greater risk if you have to take mass transit, but is not, it in part has to do with the structure of the labor market, what jobs people have, and what they need to do, or even within the household. And this is one of the studies we're doing in the data we've collected, is to look at what's the likelihood if someone is infected in your household, what's the likelihood that someone else gets infected, right? Because we talk about super sharing events, right? That like what we've seen in the White House. But then there's the question of in our houses, if someone gets sick, what determines if it spreads in the household? And what we found was that, as we noted, Black and Latinx households are more likely to get infections, but they're no more likely to see the virus spread in their household once you control for the number of people per bedroom. It turns out that having people share bedrooms greatly increases the likelihood of intra-household spreading. Not shocking, but that again goes to the socioeconomic elements of the spread of the disease that we're all, right, we've all been trying to stay away from other people for the last whatever number of months. It feels like a decade now, right? But we are trying to stay away from other people because they could get us sick, right? And our household is part of that, right? Because the people in our household, especially if they have to go out and mingle with others, are potentially bringing the disease back. But we find that, let's say, a pair of people sharing a room, let's say a bedroom in a household, are nearly 4 times as likely to both be sick than non-room sharing people in the same household. And so if you pack people together in a household, it just makes it more likely that the disease is going to spread in the household, right? And that's a pre-existing societal condition in a way. And that's when the coronavirus enters a society, those are the things that potentially facilitate the spread. We can see then also how this works in terms of employment and working at home. Working at home, in principle, allows you to better insulate yourself from getting the disease. I have not been to my office since March, right? It's just dust and dead plants there, right? I never realized I'd miss it so much, but I would love to go into my office, and I could, but I haven't needed to at this point, right? I mean, for a long time I couldn't. Now I could if I get tested and so on. But the fact that I haven't gone actually is symptomatic of a broader pattern. Look at the fraction of people, and this is, I think, from our September survey, so this is still today, who report working from home primarily. And look at the education gradient. So for people who say they have some high school, it's 17 or 18%. For people with bachelor's degree, around half of people say they're working from home. And for people with a graduate degree, it's even more, it's even a bit higher. Most people with a graduate degree in our sample report working from home. And so that just reflects the fact that, there's a certain privilege. I'm giving this talk from my screened-in porch, and I apologize for any background noise we may encounter, like from an ice cream truck or what have you. But it's my good fortune that I can be reasonably productive working from home. And in some sense, in the COVID age, privilege means that you have the capacity to evade exposure to the disease. And some of us have more of that capacity than others. And education turns out to be a remarkably powerful predictor in this regard. Similarly, not as huge a gradient, but still very large in terms of losing your job, that if you're moving bits around, you can, like I do for much of my job, if you're just moving and manipulating information, you can do that pretty effectively from home. If you have to wait tables and your restaurant is shut or at below capacity, you're gonna lose your job. And so we see a very steep age gradient in terms of job loss. And so what we've seen in terms of, education gradient. So what we've seen is if you're highly educated, you can you can avoid the disease by working at home. You don't lose your job. If you have less education, you're more likely to have to go to work, or else you're more likely to lose your job. And so that's sort of a massive divide we see in our society right now. Also, just in terms of employers taking the pandemic seriously enough, Again, we see, and I'll say Northeastern, they've taken it very seriously. They're doing, these are hard circumstances to run a university, but Northeastern has taken this very seriously. They've come up with, I think, a very impressive plan to deal with, very difficult circumstances. So I would say, if I were answering the survey, I would say my employer is taking the pandemic seriously enough. But we again see this age gradient that people with less education report that their employer is not taking the pandemic seriously enough, are more likely to report that. And so that's that. And there, I'm not trying to give you all the results here because we have so many numbers, but I just wanted to give you a flavor of the interplay of the economic components, class, gender, race, and how that affects both the economic impacts as well as exposure, potential exposure to the disease. Now, I'm a political scientist. I want to talk a little bit, it's political season. I'm going to talk a little bit about the politics of this. I should know, I don't view politics as a four-letter word, both either literally or metaphorically, but I view politics as the way in the ideal world that we translate what the population, what citizens want, and what the government does. And so I want to evaluate here really the element of what have citizens or what have citizens wanted the government to do, and what have their reactions been to what has unfolded over the last 7 months. So what do people want? People generally wanted a more aggressive response to the pandemic than they've seen. Oops, sorry. I'm just trying to move what I can see here. Basically, when we stopped asking, should we reopen the economy? Because in some fashion, the economy has been reopened, but we kept on asking the question, how soon should the economy be reopened? And, never did more than 28% of our respondents say that the economy should be reopened soon. And in always the plurality of respondents said, whoa, we need to wait a ways longer. There's always a minority who said, but definitely a minority that said we should reopen in the next couple of weeks. But most people, the typical median response was we should wait at least another month. And generally, people have felt like the federal government has not been taking the pandemic seriously enough. 50% in our most recent, I'm going to show you some time series data, in our most recent survey, 50% of respondents said the federal government has not been taking the pandemic seriously enough, versus 12% saying it's been taking it too seriously. So that's a huge imbalance. There's some interesting variation, especially when we compare Democrats to Republicans. I'm going to discuss in a moment. State and local governments do substantially better, but there's a lot of heterogeneity there. I'll show you. You can look at our. Let me see. You can look at our. Let me see. Sorry. There we go. Report for that. I'll just show you just some of the data at the party level, Democrats, Independents, and Republicans. Here's and this is, like I said, these are sort of new figures, so they don't look so pretty. The red line are Republicans, blue line Democrats. We're looking at the percentage of respondents who said the federal government is reacting about right. And we can see there are a couple things to note from this. So this is looking over time from April to September. We'll have October results in a few weeks. We can see, number one, Republicans have been approving, saying it's about right at much higher levels than Democrats, but we also see that everyone has been generally declining since April in terms of whether they think the federal government has been reacting about right. Interestingly, if we look at Republicans, we see the decline in the blue line here, reacting about right, has been going down. But what's interesting is there have been polarization in the views of Republicans. So Republicans have both been increasing in how many Republicans say they're overreacting. So more Republicans now say that the federal government is overreacting than in April. But also more Republicans are saying that the federal government is not taking the outbreak seriously enough. And so there's this interesting among Republicans polarization of views, saying that we're doing too much or too little. Democrats, on the other hand, just generally have been trending in saying, very few Democrats have ever said that the federal government is overreacting, and the number who have been saying that we've been reacting about right has generally been going down. Again, during the summer, it sort of plateaued. It'll be interesting as we go into the fall what will happen, but generally Democrats have been trending, and the large majority of Democrats say, well, we have not been taking this seriously enough at the federal level. If you look at our reports, I'll note that we have reports on approval of the governors and Trump's management of COVID-19 for all 50 states. And this is, again, we have such a large survey, we can do this deep dive. Here we can, in the bottom right figure, we can look at national figures for Trump. And we can see, and for governors, we can see generally approval of Trump and governors has gone down. The dotted line is Trump approval of Trump's management of COVID-19, which started low and has gone lower, hasn't declined as rapidly as governors who are starting at a higher level. But generally Trump's approval level is much lower than most governors, although it varies a lot regionally. Interestingly, again, we can look at approval of governors by party. We see a big partisan difference. Here we're looking at Republican governors. Republicans generally approve much more of Republican governors than Democrats approve of Republican governors. There has been a decline in approval for Republican governors, as there has been in Democratic governors. Generally, Democratic governors have somewhat higher approval than Republican governors, but there's a subset of governors who have by far the highest approval of all, which is Republican governors who have responded relatively aggressively. And so these are the Republican governors in New England, so Massachusetts, New Hampshire, Vermont, as well as the Republican governors of Maryland and Ohio. Remarkably, they actually have slightly higher approval among Democrats than they do among Republicans, and really generally they're the envy of governors everywhere in terms of approval level. So that's a sort of interesting sort of exception to the overall pattern of partisanship that we see in this country more generally. We've seen a general declining trust in our institutions, although there's a lot of variation. We've been asked people to trust in politicians and institutions. We see generally very high approval level of doctors and hospitals, as well as scientists and researchers. There's a reason why that Biden has repeatedly said, I'm going to do what the scientists and researchers said. It's a politically wise thing for him to say, because most people actually sort of trust the scientists and trust the doctors. We see a lot, unsurprisingly, we see, as we get to sort of more political figures, there's lower trust in Trump. There's very, very low trust in social media companies. There's an interesting pattern when we look at Democrats versus Republicans in trust. Generally, both Democrats and Republicans trust doctors and hospitals. There's a small partisan divide. Democrats have slightly higher trust of doctors and hospitals and slightly higher trust of scientists and researchers, but generally, actually, both Democrats and Republicans have very high trust of scientists and doctors. Unsurprisingly, there's a big partisan divide for political figures, for Trump, especially Trump, not shockingly, has the biggest partisan divide. And also Biden is a big partisan divide in trust of news media and an emerging partisan divide in trust of Fauci and the CDC. But generally, both Fauci and the CDC actually have very high trust levels. And so there, like I said, there are, you can go to the reports to dive into the details, but there are sort of some places where there's bipartisan consensus and other places where there are big differences. Police are an interesting case where generally trust levels, there was a small partisan divide that became much larger in the late spring with the Black Lives Matter protests and with the death of George Floyd. So there are some interesting dynamics there as well. This will matter also when we look at vaccine acceptance. We can anticipate sometime in the, sometime, and we'll see when, but I'm guessing the winter, that a vaccine will start to become available. And we asked people if they would be, how likely they would be to get the vaccine. Interestingly, we found that the trust that we see a big partisan divide, and in particular, we also see a trust Trump versus a divide. So if the Democrats are more likely to report being willing to be vaccinated, Republicans less so, and Republicans who trust Trump are especially less likely to report being willing to become vaccinated or vaccinate their kids. And so this will become, and a lot of this really is probably due to prior, it's not because of Trump, it reflects prior distrust of the system, because if we look at people who got this, there are somewhat similar patterns when we look at who got the flu vaccine last season. So health-related behaviors, I'm not going to dwell on this, but this is one we were just pulling up, how this has varied over time. And unsurprisingly, if we look in the green line, we're asking have you been in a room with people outside of your household in the last 24 hours? And the people who said they have not been in a room, that number has, I'm guessing we don't have baseline. We don't know what, we didn't think of asking this before the pandemic. That truly would have been prescient. But we do see, on the one hand, the numbers are still, most of us report not being in a room with someone from outside of our household in the last 24 hours, but those numbers have been declining, meaning more of us have been near others, right? So that, again, is at least depending on how we're doing it, being in a room with someone is intrinsically a somewhat risky behavior, more risky if you're not wearing a mask, but we know being in enclosed spaces with other people it just increases the likelihood of transmission of the disease. And again, that's part of what we've seen in the White House super spreader event. We also see things like going to restaurants have increased, roughly tripled from where they were in April and May. And on the other hand, we've seen mask wearing going up dramatically from 55% to 75% from April to the present. Again, there are actually big partisan divides in all of these things where Democrats are more likely to be adhering to health recommended lower risk behaviors. So what's in our pipeline? I'll give you a tiny preview of a report we're releasing this Friday. One of the big interesting dynamics around the election is voting by mail. So we have a report that's looking at the difference between all people who are going to vote versus those people who are just voting in person on election day. And it turns out that those people who are voting, who say they're going to vote in person on election day, favor Donald Trump around 3-1, according to our survey. So huge, remarkable advantage for the people who say they're going to vote on election day. But if we look at everyone who says they're going to vote, Biden has a 10-point advantage, 50 to 40 in our survey. And so what that creates is the possibility that if there's a time lag in counting votes, that we're going to end election day with Trump leading and then all the margin shifting towards Biden as those votes get counted. And so what we have here, and we'll have all states in our report, but what we have here is we selected 9 states. We zoomed in on states that are competitive, and we estimated how much we expect the vote to shift from those people, from people who vote on election day to all voters. And so like in Alaska, we see that's going to be the smallest shift, but still going to be like 17 or 18 point shift in Alaska from voting election day versus vote by mail. I should note, by the way, the reason also we've zoomed in on these states, not just because they're close, is also because they may be slow in voting. Because some of these states, like Alaska, Ohio, Nevada, accept ballots after election day. The ballots can drift in by mail. Other states have the policy that they do not start processing votes by mail until election day. And if you imagine that you're being deluged by millions of votes coming in by the mail, that's going to be a formidable logistical challenge. And so we can see that a state like Nevada, where votes will be drifting in for some time afterwards, that there literally may be like a 60-point shift from the count on election day to counting all ballots, because so many people anticipate voting by mail, and because those people who don't plan to vote by mail are vastly disproportionately supportive of Trump. So we can anticipate potentially very large shifts towards Biden as those votes by mail get counted, and that those shifts will likely are enormous. So we could well imagine that there will appear to be a popular and electoral vote victory for Trump on election day that then becomes a substantial Biden victory in the days that follow. Final thing, we've been doing the stuff on testing delays, and we've been asking people, how long they've had to wait to get testing results. And this is really important because you need to isolate yourself if you're infected, right? You may not realize it, but you may be infected and you may be infecting other people. And we've just been incredibly slow. We've just been shockingly slow. I just cannot believe how slow our country has been in gearing up our testing capacity. And the good news is that we have substantially improved the speed of testing in the US based on our surveys since August, basically going from around 4 days on average to a little less than 3. So that's a big improvement. But the bad news is that it's still way too long. So looking into how much people wait to get tested and then how long they wait to get results, it takes almost a week between the time you're like, I should get tested, to when you actually have the results in hand. And so if you're someone who's like, I was in a room with someone who later turned out to be infected, I should get myself checked out, right? You might be literally spreading the disease to vulnerable people during that week time, because you're like, I'm probably fine. And then you get the test results, you're like, oh, I wasn't fine. And then what's even more bad news is that ideally you go to the people who report positive and you ask them, who have you been in contact with? And you reach out to those people and say, you need to get tested and you need to isolate yourself. Only about half the people who were tested in our survey and reported being positive reported any efforts at contact tracing. And that's just tragic, right? Because this is the best way, one of the best ways, not the only way, but one of the best ways to get out of our conundrum is to test people constantly and isolate people who may be infectious And if you do that rigorously, then we could open up the schools, we could open up restaurants. There are countries in this world where that is happening, but the US is not one of them, unfortunately. So we have lots more stuff. I've tried to just give you some taste of this. Go to COVID States, go to covidstates.org, and you can see our reports. You can sign up to get early alerts to what we've recently released. So again, I'm thank you for waiting patiently while I've walked through this. Thank you very much.